All right, we're going to start today, this Wednesday, like how we start every single Wednesday, bringing on our special guest from OrthoVirginia on this Wednesday morning as it's Physician Assistants Week. We're welcomed on by Kim Waters. Kim, thank you so much for taking some time out of your morning to chat with us.
Hey, yeah, happy to be here. Thanks for having me.
Yeah, of course. I just want to start off with kind of explaining what a physician's assistant is, because I think sometimes we see the PA at the end of the name and we're not always fully aware of what those two letters stand for or what they mean.
Yeah, so physician assistant, I think a really good way to describe it is almost like a physician extender. And so we are advanced practice clinicians. So we see patients, we treat our own patients, we prescribe medicines, we diagnose patients, all of that stuff. And we provide a lot of access for patients that our physicians normally wouldn't be able to reach. They only have so many hours in a day. And so as a physician assistant, I can see a lot of patients and treat them appropriately and get them in and get their injuries looked at a lot quicker and provide a lot of value to the patient.
So just out of curiosity, when you are working with patients, working with athletes and injuries, when they're coming in, what is the most common injury that you see in athletes?
Yeah, so I think it depends on the season. We primarily see shoulders and knees. So I see a lot of, in our younger athletes, labral tears, older athletes, rotator cuffs for the shoulder, for the knee. We see a lot of ACLs and meniscus. I think those are probably the top tier surgical ones that we see.
So when you see it now in the fall season with the meniscuses and MCLs, it brings us into the commander season. I know you guys don't work specifically with the athletes, just kind of sharing the expertise, but Jaden Daniels just went through that MCL sprain and everything. And there was talk, is he rushing back? Is he fully ready to go? From your perspective, what are some of the risks that come along with potentially rushing back from an injury like an MCL sprain?
Yeah, so I think every surgeon has their own treatment plans, and every patient obviously is very individualized. And so, not speaking directly on his situation, but in general, the biggest thing we worry about, rushing back or returning too early than what's appropriate is obviously the risk of re-injury. And so that's something that we counsel our patients on, and we have specific guidelines for a reason to kind of keep them safe on the field.
When you are seeing patients, what are the differences in injuries that you see between athletes and then someone like me, a non-athlete who isn't doing those same types of, moves and things of that sort?
There's a lot of overlap. I think, I've seen someone tear their ACL, being a weekend warrior. So there's definitely overlap between the two. I think really the recovery looks a little bit different. We have someone who's a college athlete who we see routinely, and, their level of expectation treatment wise, being able to return to the soccer field for, a collegiate sport is a lot different than someone who just wants to, be active and stay healthy over the weekend.
So something we also hear a lot about with athletes is the difference between turf and grass and how that kind of impacts joints. I was curious, in your experience, do you see different types or maybe more severe injuries when it comes to turf versus grass, or is that something that doesn't pop up as much?
That's hard to tell, because I think that, if you look at most fields now, there's a lot of turf out there. And so we're still seeing the same injuries that, we saw, 5 years ago. So, it's hard for me in my experience. I haven't specifically looked into that to really kind of form a opinion to share.
Yeah, no, it's always an interesting thing because you hear like the professional athletes talk about it so much, and you don't hear it too much between the collegiate level and the high school level. So it's always something I'm interested in if you see it then on the back end where you guys are actually working with it, because we there just hasn't been a lot of studies. There haven't been a lot of, outside of anecdotal evidence, there hasn't been a lot of evidence one way or another. So it's
Yeah.
always interesting kind of diving into that.
Yeah, it sounds like a good project we need to look into.
Kim, you kind of touched on it earlier, but overall, how do you work with the doctors on diagnosing an injury and kind of putting together a treatment plan?
Yeah. So I usually am the first person that the athlete may see in the office, right? They get injured at a game. Obviously, the athletic trainer will see them on the sideline, and we love our ATs. And if they get injured at a game or over the weekend, they'll want to get in pretty quickly. And so my schedule allows for that flexibility. So often I'm seeing the patient, getting the initial workup, getting a history. I do a physical exam on them, come up with a diagnosis or probable with a diagnosis, and really order any appropriate imaging. Do they need an MRI? Do they need a specific x-ray? Do we need to get them plugged into physical therapy, prehab, that sort of thing, before they get presented for Dr. Smith to evaluate surgical intervention.
What's your role
And
with the
Dr.
athletic
Smith,
trainers? Sorry, go ahead.
but Dr.
Uh,
Smith and I, we work very closely in clinic. We're literally side by side. So if there's ever a patient that, I'm worried about, or, I'm just kind of unclear of what's going on, I can always pull him in. So we work very closely, a lot of collaboration going on.
And you mentioned the athletic trainers. What's your role with the athletic trainers, kind of working with them post-injury and kind of putting together a plan? Like, how do you work with them in the immediate, I don't want to say aftermath. That makes it sound like it's a really bad thing, but in
Yeah.
the, like, immediately after what
And the
happens on the field.
recovery.
Yeah,
Yeah.
thank you. That's a much nicer word than aftermath.
Yeah, I got you. So they reach out to us quite a bit, and we love the communication. And so the athletic trainer will text Dr. Smith or call him and be like, hey, I saw this patient, this is what happened, this is what I'm worried about. And so we'll get them in. And I think in terms of recovery process, we work directly with them to make sure that they're taking the right steps, rehabbing and doing the appropriate, not letting them move too fast or too slow. And so we work pretty closely with them, and we love the assistance that they provide us.
That's awesome. And as you kind of go through the recovery process throughout every step, what's your role with the patients throughout the entire process from start to finish?
Yeah, so for non-surgical patients, because I know we hit a lot about surgery, but for
Mhm.
non-surgical patients, sprains and things, I see them from start to finish, and so I see them, evaluate them, make a treatment plan, and kind of see them through that journey, which is incredibly rewarding to have that autonomy. For surgical patients, after surgery, I see them for their initial 2-week follow-up. So for most orthopedic injuries or surgeries, we want to see about 10 to 14 days after surgery. And so I'm usually the one who will see that appointment. And then I work with Dr. Smith, later on, kind of taking turns seeing patients.
And where can people go to learn more about OrthoVirginia's orthopedic services?
So you can go to OrthoVirginia.com. And if you type in my name, or I work with Jody Smith, who's the physician here, type in either of our names, you can get directly to our page and schedule an appointment if needed.
Awesome. Kim, thank you so much for taking some time out of your morning, chat a
Yeah.
little bit with us. Have a great rest of your Wednesday.
Thanks so much. See ya.